Representative Donna Oberlander.
Thank you, Chairman. Good afternoon, Secretary. It's always a pleasure to see you.
You too.
I'm going to change the direction a bit. I want to commend you on your hard work in identifying waste, fraud, and abuse.
Thank you.
You've done a great job, and specifically in the area of medical assistance transportation, the methadone changes have really saved a lot, as you're well aware. My concern is that medical assistance transportation program continues to grow, and the estimations are that there will be additional 560,000 trips for this fiscal year, an additional 610,000 trips for 2014 fiscal year, which comes up with almost 10 million one-way trips. We continue to hear from counties that their ability to provide this public transportation is declining as a result of their fiscal strains. And I'm wondering, as the utilization continues to grow, what steps is the department taking to create efficiencies, and how is this, the change in the private vehicle allowance, has that had any impact on this?
Okay, hold on one second. A couple questions in there. First off, when I was back in York County as the Executive Director of Human Services, this was my biggest headache. So I do understand, and the federal rules, many of them require us to provide transportation. So as part of that, we are trying to work through how to create a system that meets the needs of the federal government and also the people of Pennsylvania. And the change in methadone, we're still looking at it, we're still doing reviews, and we will continue to see. And I'll tell you what, honestly, that had come off my priority list with Healthy PA and the Affordable Care Act, and I think we can bump that back up and take a look at that this coming year. So we will look at that. I think what you're talking about as far as the private is it the medevac issue?
No, it was if I choose to use my private vehicle. I used to be provided a subsidy of 25 cents per mile, and I believe it was reduced to 12 cents. My concern is that would then push people into the more expensive transportation options, where if we were to pay that bigger amount per mile, maybe we wouldn't have so many using the other systems.
Let us take a look at this and get back. Do you have anything to add?
I was just going to say, we did make the change to reduce the reimbursement rate, but we really haven't looked at we can go back, we may have looked at the utilization between them to see is it more cost effective to do that or not, but we can go back, take a look and provide you some information on that.
I certainly appreciate that, and again, thank you for your good work.
Thank you.
Thank you, Chairman.